Hi, I'm Kate. I'm in Sacramento, California, and I'm an iFuse patient. After the initial surgery for my L4, L5 fusion, the pain got better. However, after a couple of years, I started to experience increased pain in that area. I noticed that I wasn't able to sit for any extended periods of time. I would have problems laying down, standing for long periods of time, going upstairs, and it just increased to the point that the pain medication alone wasn't helping. I managed, but the pain was always there. I think we tried just about everything. We tried pain medications, injections, ablations. I had a neurostimulator. What we ended up doing is trying to manage the pain with medications. I used to golf a lot. I gardened a lot. And it got to the point that I had to hire someone to come in and do my gardening for me, which was really difficult watching her do all the work while I was on the couch looking out through the window. We would go to our basketball games, and by halftime, I would be up out of my seat and having to walk around the concourse because I couldn't sit any longer because of the pain. My pain management doctor said I was a good candidate for this procedure, and she referred me to Dr. Loidolt, my surgeon.
My name is Travis Loidolt. I'm an orthopedic spine surgeon practicing in Folsom and Roseville, California. We're here to talk about the sacroiliac joint and the impact fusing that joint can have for patients and changing their lives. So the lower spine comes down and attaches to the pelvis via the sacroiliac joint. And there are a lot of forces that go through that joint, and therefore if it becomes painful, it can affect all aspects of somebody's life. Patients start to notice sacroiliac joint dysfunction for a number of reasons. Sometimes it can be pregnancy, sometimes a trauma, and sometimes what is called adjacent segment disease. About 15 to 30% of the population who has back pain has pain actually coming from the sacroiliac joint. Lumbar spine fusion patients also still having back pain after surgery. About 40% of the time it's coming from the sacroiliac joint. So it's important to take a good history, ask the right questions, and figure out when does the pain come on, what makes it better, what makes it worse, and then also a physical exam so we can formally diagnose where the pain's coming from. And then furthermore, we can do diagnostic tests and injections to help confirm our diagnosis. Once the diagnosis is confirmed with a history, physical exam, and diagnostic injections, we can also do what are called therapeutic injections, where we inject a medicine that may last a little bit longer and potentially give patients relief. If ultimately all conservative measures fail, then they can end up undergoing a sacroiliac joint fusion surgery. The sacroiliac joint fusion surgery is considered minimally invasive. It's a small incision on the side of the buttocks. Typically we place 2 to 3 implants per side when we do the fusion surgery. I typically use the iFuse system. It has a long track record. It has streamlined instruments to help minimize soft tissue damage. And ultimately, the outcomes that I have experienced in my practice have been phenomenal for the patients.
So we went and saw Dr. Loidolt, and he spent a good amount of time with us explaining the procedure, helped us understand the risks, and we very quickly decided to go ahead. So the surgery was very successful. I didn't experience any complications. My recovery went very well. And within 6 weeks, I was off of all of my pain medications. Since the surgery, I have been able to go out and garden as much as I want to. I'm also playing the guitar. I'm able to extend my lessons to an hour now and can actually sit and play for several hours without any discomfort. I am able to go to the basketball games and actually sit throughout the whole game. I wish we had had the surgery earlier and had known about it earlier. It took a while to get there. Because of the surgery, I was really able to get my life back.
Once I started really looking at the sacroiliac joint as a pain generator and understanding the treatment options, it opened up my practice to be able to treat more patients. A lot of times patients that come to me haven't gotten the answer they've needed. They haven't got the right diagnosis. Injections in other areas of the spine have not worked. And when we formally diagnose the sacroiliac joint and are able to treat them, whether non-operatively or surgically, they are very happy to get their life back.